Mastoid surgery. Mastoid is a part of the bone which is present immediately behind the ear. We will see a little bit about the types of mastoid surgery. Basically, mastoidectomy is the only mastoid surgery, but again, different procedures are there. Like it can be a cortical mastoidectomy, a modified radical mastoidectomy, a radical mastoidectomy, so on and so forth. Let's get started. Mastoid surgery can be of two types: canal wall up procedure, canal wall down procedure. Okay. Canal wall up procedure, the posterior wall of the canal wall we're talking about is the external auditory canal wall. So the posterior wall of the EAC is destroyed, and canal wall down procedure it is preserved. An example: cortical mastoidectomy, posterior tympanotomy, tympanoplasty. Okay, these three comes under canal wall down procedures. Canal wall up procedures are MRM and radical mastoidectomy. Okay. Just remember RUM, that is RUM, R for radical mastoidectomy, U for up, which is canal wall up procedure, and M is MRM, modified radical mastoidectomy. Let's see every type of mastoidectomy in detail. Cortical mastoidectomy, complete excenteration of the mastoid air cells through the aditis, removal of the disease from the middle ear by preserving the posterior canal wall. It is the surgery of choice for all types of mastoiditis, meaning the inflammation of mastoid process. Complete cortical mastoidectomy, where the problem is in the sinodural angle, otherwise called as the Citilli angle. There's a Strotman triangle, which is related superiorly to the dural plate, posteriorly to the sigmoid sinus bulge, and anteriorly to the bony labyrinth. The third surgery which we are going to look at is modified radical mastoidectomy. After cortical mastoidectomy, the first step is to break the posterior wall of the posterior wall of the external auditory canal. After we break the posterior wall, the external auditory canal, the middle ear, and the mastoid atrium are converted into a single cavity, meaning initially they were like two separate cavities, but now it's going to be a single cavity. Second step is to remove the diseased ossicles, meaning the malleus, incus, and stapes. Third step is with remaining normal ossicles, tympanoplasty is done for hearing reconstruction, because obviously you're going to remove the ossicles. The job of the ossicles is still pending, which is very crucial. So first we are going to break open the posterior wall of the canal, and we're going to remove the ossicles, and we're going to reconstruct the middle ear ossicles by using the remaining ossicles. The மிச்சம் மீதி pieces எல்லாம் வச்சு we're going to reconstruct. Surgery of choice for atticoantral disease or for atticoantral disease with complications. So like if the attic is involved, attic is like the rooftop, so if the rooftop is problematic, the posterior wall is going to be broken down. That was about MRM. We will say RM, which is radical mastoidectomy. The first step, it is same as MRM's first step. First, we are breaking open the posterior wall of the EAC, converting it into a big cavity, a single cavity actually. Second step is removal of the diseased areas, the diseased tissue, along with like the ossicles, basically every ossicle except for the footplate of stapes, because footplate of stapes is attached to the window. All right. The third step is to close the eustachian tube opening to prevent further infection of the middle ear, because the most common site from which the ear is going to get infected is the throat. So like we're going to cut off the connection between the throat and the ear, so preventing infection. Okay, so that was radical mastoidectomy. It is the surgery of choice in any extensive tumors and extensive cholesteatoma where modified radical cannot be performed. So like radical is usually an extensive surgery, modified radical is usually a conservative procedure, which is good in the sense it is going to preserve most of the tissue. Right, the fifth surgery is posterior tympanotomy or a facial recess approach, meaning after we perform a cortical mastoidectomy, a window is created in the posterior wall where the facial recess is present, and through the window the disease is removed. So here also the disease is removed, okay? As a quick recap, mastoid surgery is nothing but mastoidectomy, removal of the mastoid process. We are going to remove like other stuff like damaged ossicles, damaged tissue, but mostly if it's modified radical, it's conservative. We're doing a good job at it. Well, if you have a middle ear infection, obviously go seek medical attention because it might cause hearing. Thank you.